CBT is one of the most popular forms of psychotherapy, and it's evidence-based, meaning there's a lot of research that shows CBT is effective. But I've heard several people, both therapists and clients alike, saying they don't like CBT. In fact, some people claim that it's more like gaslighting, or you're just teaching people how to deceive themselves and not be in touch with reality. So which one is it? Is CBT really an effective form of therapy, or is it gaslighting? In this video, we'll go over some of the main reasons why people don't like CBT and explore whether or not it is an effective form of therapy. Hi, I'm Dr. Lori Parker, and I'm a therapist, educator, and consultant, and I love teaching people tips for how to improve their mental health and start living their best lives. So let's start with just a basic explanation of what CBT is. The basic idea, or the main idea behind CBT, is that it's your thoughts or the way that you think about things or interpret things that influences how you feel and how you behave. So in other words, common disorders like depression, anxiety are caused by maladaptive or negative thinking patterns. For example, if you engage in a lot of negative self-talk, if you say to yourself all the time, I'm lousy, I'm so stupid, I'm worthless, I never do anything right. In CBT, we would examine those negative thoughts and how they impact you. So here are some things that can happen, unfortunately, or reasons why people may not like CBT. Number one is rigid versus flexible. That sometimes CBT can come across as too rigid or something that's very structured. As the field has moved towards more evidence-based treatments, meaning research-based treatments, sometimes people have looked at it as, another term we've used in the field is manualized treatment, meaning there are certain steps, step by step that you're supposed to follow, almost like a recipe, in order to implement that form of therapy with the client. But sometimes clients can react to that as, well, this therapist isn't really paying attention to me and my personal problems. It just feels cookie cutter. Like, yeah, this is almost like a one size fits all. But therapy is not one size fits all. It's important to be able to tailor the therapy to that person's specific personality and their specific problems. One example is I was supervising a student one time. And supervision means that I'm helping to train that student how to become a therapist. And the student kept coming in week after week sort of complaining, well, this client isn't getting any better. Like, I keep giving this client homework assignments and the client's never doing the homework. And so finally I stopped one day and I said, well, tell me a little bit more about this client. How old is the client? And the student was like, oh, well, I'm not exactly sure. Well, tell me something about this client's history. Like, what's their family like? Where did they grow up? And the student again was like, I'm not really sure. So it became apparent that the student was so concerned about doing the therapy right, meaning following these steps or this recipe for exactly how they were supposed to do the CBT, that they didn't even know the client. So I told that student, let's take a pause with the manual. And why don't you spend some time just trying to get to know this client? I said, put it aside and just get to know this client a little bit better. So that's one of the reasons why sometimes people say they don't like CBT, is because it seems too rigid. And, doing therapy is an art and a science. Yes, we need to follow the science. Yes, we need to follow what the research says for the best strategies, the most effective strategies. But the other part of it is getting to learn this person's specific personality, their struggles, their particular history. And when you get to know that client, then the art part of it is being able to fit those effective CBT strategies to this specific, unique person. A second complaint that people have about CBT is that sometimes it comes across as lecturing. So I think of this as lecturing versus listening. And one way to sort of gauge this is to see how much your therapist talks in session. Because in therapy, who do you think should be talking more? Actually, it's the client who should be talking more than the therapist, which means the therapist should be taking more time to listen. So yes, in CBT, we emphasize something called psychoeducation, where we educate people about different psychological concepts, or we need to teach clients about these specific CBT strategies and how to do them on their own as homework. But in order, as I said with number one, in order to be able to come up with those most effective strategies, we have to take the time to listen, right? So it's important to be careful in using CBT not to lecture too much. And if you have a therapist who's doing that, you can actually ask the therapist, say, hey, I'd really appreciate it if you would stop and listen for a minute. That's really good information, but I have a lot that I want to share with you too. And yes, that's okay. It's okay to ask therapists for what would be most helpful for you. Another thing that people complain about related to this idea of listening versus lecturing is using worksheets. Now, that's not necessarily a lecture, but in CBT, yes, there are worksheets that we can use to give people that can be helpful for them to do certain things, like identifying their negative thinking patterns or their negative self-talk. But again, how do you know what worksheet to use? Or how do you know which worksheet will be most helpful for this particular client? That's the art part. You can't just throw worksheets at people. So it can be easy to fall back on the psychoeducation or lecturing people, or on the worksheets, like just give them the worksheet and have them do it. But that's not effective for a lot of people. So you're probably starting to see a theme here where there's an emphasis, or hopefully for the most effective therapy, there is more of an emphasis on relationship building rather than using specific strategies. In fact, that's what the research shows, that for effective therapy or successful therapy, the most important thing is for the therapist to be able to build a strong, positive working relationship with the client. So one of the other reasons why people don't like or tend to complain about cognitive behavior therapy is because sometimes there's more of an emphasis on problem solving than relationship building. And what I mean by that is sometimes the therapist will try to rush and solve the client's problem. So some therapists think, oh, this client's depressed. I know exactly what to do. This is what the CBT manual says that I should do with someone who's depressed. But if you haven't spent time building that positive relationship with the client, the most effective research-based techniques in the world are not going to work. So a focus should still be on relationship building, not necessarily problem solving. Another reason why people may think of CBT as not very helpful and closer to gaslighting is because of what I think of as surface level versus deep level. Similar to some of the things we talked about in the last complaint, when a therapist rushes to and sort of assumes that they know what the person's problem is, like if they say, oh, I know this person is depressed, I know these symptoms, I know what to do. When you're not taking enough time to explore, to really allow the client time to talk about their feelings, not just the thoughts, but also the feelings, and to tell their story and explain their history and all of those things, again, it can feel to the client that you're just staying on the surface level and you don't really know them. An example of this might be affirmations. So, an affirmation is when you tell someone to say something positive to themselves. The example I gave earlier about negative self-talk, affirmations is a technique that can actually be very helpful for people who engage in a lot of negative self-talk. So if someone is saying to themselves, I'm lousy, I'm worthless, I'm no good, we try to help them think of positive things to say to themselves, like, I am worthwhile, I am worthy, I am lovable. Those are examples of affirmations. Affirmations can come across to people as very fake. Again, especially if you haven't taken the time to really explore what's going on around that person's self-esteem. So they might think, oh, I'm not going to do this. This is stupid, right? Like, I was just saying to myself, I love myself. How is that going to help? So when you tell that person to love themselves, when they really don't, it feels fake. And it feels like you're just staying on the surface level. Because there's a reason why that person thinks that they're lousy and worthless. And then if you follow kind of like the trail of crumbs back, that person may even hate themselves. They may even have self-loathing. Well, where did that come from? Likely that comes from somewhere in their history. And it's important to get to that so that you are working at a deeper level and not just staying stuck at the surface level. So if you see someone like a client who's not changing, or if you are the client, if you're the person in therapy and you feel like it's not effective, that might be the reason why. It might be because your therapist hasn't taken the time to really get to that deeper level with you. And again, that's something that you can ask for, something you can say to your therapist. Hey, I think that we're kind of staying on the surface level. I'd really like to be able to get to a deeper level. Can we talk about my history? Can we talk about my past? Can we talk about some of the other significant things that have happened in my life? It's okay to ask your therapist for that. Another very common complaint that people have about cognitive behavioral therapy is that it doesn't deal with feelings, that, CBT therapists ignore feelings, and that couldn't be farther from the truth. In fact, one of the main founders of CBT, Dr. Albert Ellis, his form of therapy is called rational emotive therapy. So yes, he focused on rational thinking, but also notice the emotive part, which stands for emotions or your feelings. He also emphasized feelings. So that is something that we need to explore in cognitive behavioral therapy. Or some of you may know the foundation of cognitive behavioral therapy is the cognitive triangle. And in that triangle at the top, it's thoughts, but at the bottom you have feelings and behaviors. So feelings are a core component of that cognitive triangle. And one of the things that I do with clients is helping clients identify their feelings. Sometimes clients will just come in saying, I'm overwhelmed or I'm upset. Those are feelings, but they're also very complex feelings. And we need to tease those apart. So if someone says, I'm overwhelmed usually involves a lot of different things. Maybe they're feeling sad, anxious, frustrated, angry, scared. So a lot of different feelings can go into being overwhelmed. And it's important to spend time helping the client tease those apart and identify them and express them, to spend time expressing those feelings, understanding where those feelings came from, understanding what those feelings might be communicating to you. So it's important to spend some time talking about those feelings. Another reason why people may not like CBT is because they feel like it invalidates their experiences, or something that they've experienced. They feel like the therapist is trying to convince them that that wasn't real, or going back to feelings, that the way they feel about that experience isn't based in reality. And again, that couldn't be farther from the truth. Unfortunately, I know, and I've had clients who've shared experiences that they've had with other therapists where their therapist actually did gaslight them. And I'm going to give you an example. This isn't a real person. I'm drawing on real things that clients have told me, but to protect people's privacy, this isn't a real situation, but it's a common one. For example, let's say the client sits down and tells the therapist, I'm having a lot of stress at work, and I feel like my male boss, if the client is female or female identified, saying, I think that my boss could be misogynistic. I think that my boss is sexist and doesn't really like women. I feel the way that he treats me, and I see the way that he treats other women in the office. And I think that's part of my stress at work, is because I think my boss is sexist. The therapist might say to the client, well, maybe your boss isn't actually sexist. Maybe it's just the way you're thinking about it. Or maybe you're misinterpreting that situation. Or even if the therapist says, oh, well, even if your boss is sexist, if you change the way you think about it, maybe if you change the way you interact with your boss, maybe your boss wouldn't treat you like that. So unfortunately, this does happen, but I want to say clearly that is not okay. As therapists, we need to assume that our clients' experiences are valid. So it's true, we're going to go through and we're going to analyze the way the person is thinking about it, and we're going to see if some of those thoughts might be distorted or not based in reality. But we shouldn't start from there. We should always start from validating the client's experience and saying things like, hey, it sounds like that's a really stressful situation. It sounds like when your boss does things like that, it really makes you feel this way. So whether I personally think that the boss is being sexist or misogynistic or not is not really the point. It's that is how the client is experiencing that situation. And that's at least where we need to start. Related to that complaint about valid versus invalid experiences is also the idea of, is this my individual problem, or is it something about the situation or the context? This is another thing that can feel like gaslighting. That, if the person is experiencing something real in their environment, but we only focus on the individual and on them changing themselves, it can, we can be missing something really important, that there are environmental or even systemic institutional things that impact people. So go back to the example I just gave about the female client who's saying they're experiencing sexism from their boss in the workplace. That's an environmental issue, right? That boss very well could be sexist, and that boss's sexist behavior or misogynistic behavior may be being supported by the institution, right? And by society. Our society, at least here in the United States, we are still a patriarchal society. Men just have more benefits and more privileges than women do, and that the workplace can support that and reinforce that. So again, if I start from the place of this person's experiences are real, I'm also going to say, well, maybe I need to consider it's not just their individual problem. Maybe there really is something about the context, the environment, the situation that is impacting this person. And I'm still going to work with that individual client about how they might be able to cope with that situation differently. But again, I'm going to start from there. And sometimes that's so helpful. Like when clients have been experiencing these situations and they are questioning themselves, they're being gaslit, and they think, is it me? Maybe there's something wrong with me. And maybe they're even being told, oh, you're being ridiculous. You're being too sensitive. So they question themselves. Sometimes it can be so helpful for me as the therapist to just say, no, you're not crazy. What you're experiencing is real, and how you're feeling about it is valid. And sometimes that's just such a relief for clients. Another complaint that people have about CBT is they feel like it's gaslighting because they feel the therapist is trying to convince them that the way they're thinking about things is wrong. And so I think of this one as arguing versus guiding. And I've experienced this myself, and I have to pay attention. So sometimes if I'm speaking with a client and, I'm trying to help them see some negative thinking patterns and they're kind of resisting or pushing back a little bit, and I might find myself getting a little frustrated or irritated, and then I have to stop and I have to ask myself, because sometimes then it actually does start to feel like I'm arguing with the client. And I have to stop and check myself and be like, okay, I'm not supposed to be sitting here arguing with the client. I should be guiding the client. So I stop and I think to myself, let me just go back to listening mode and just get in touch and really, connect with what the client is saying, what they're thinking, what they're feeling, and try to figure out what the resistance is about. And maybe that's it. Maybe they just feel like I'm trying to push them too much to change the way they're thinking. Instead, I should think about it as guiding, right? I'm guiding the client to a place that is healthier for them, or that's less depressed, less anxious, to improve their well-being. So I shouldn't be trying to convince the client or like argue with the client. It's like, how can we work together to get to that place? What kinds of questions can I ask you? What kinds of things can I suggest that you might try? See all the tentative language, right? I'm suggesting so that you might try something, and maybe this will help you, maybe it won't, but let's try an experiment and let's see if it works out. So that idea that a therapist should be guiding the client towards particular goals, not necessarily trying to convince or trying to argue with the client. Notice that most of the points we've made so far have focused on the therapist and things the therapist might be doing to make the client feel uncomfortable or to make the client feel like they're being gaslit. I don't know how to say the past tense. Is it gaslit, gaslighted? You know what I mean. But there are also some things that the client may be doing that result in CBT not being as effective or as comfortable. And one of those things I describe as perceived reality versus actual reality. And sometimes this can occur when change is starting, or when, as the CBT therapist, we suggest changes. Like, what if we give homework? And what if the homework is affirmations? The person is struggling with negative self-talk, with negative self-esteem, and we're assigning some positive statements for that person to practice saying to themselves. At first, the person may say, no, well, that's fake, that's phony, that doesn't feel real, because the person is so used to being in that place of, looking at themselves in a negative way and saying so many negative things to themselves. That's what feels real. But if we're going to change that, we're trying to get to a new reality. And we have a saying in CBT. Sometimes we say, fake it till you make it. That's changing the behavior, that sometimes we need to change the behavior first, and then the feelings and the thoughts will follow. And so I give that warning. I let clients know, hey, when you start saying affirmations, it is going to feel fake and it is going to feel phony. But the thing is, when you keep doing it, eventually, like, your brain doesn't really know the difference. That's a feeling. It feels fake or phony. But when you keep practicing things over and over, your brain doesn't often know the difference between what's fake and what's real. If you keep saying it to yourself, eventually your brain is like, oh, well, yeah, we really do like ourselves. And then it starts to feel real. It starts to feel more natural. A therapist can help you critically analyze those thoughts and those feelings. You can test them out, right? They can be like hypotheses, and you develop experiments to test if that thought is real. Like that thought, I never do anything right. Well, let's examine the evidence for that. Maybe sometimes you do things right. So it's taking some time again to help guide the person in evaluating those thoughts and feelings and testing them out to see if they are valid or not. Or sometimes there are thoughts and feelings that we have that are valid, they are true, but maybe they're not helpful. And that's another way that therapists can help with, critiquing or critically analyzing these thoughts and these feelings and even the behaviors, is that might feel real, or it might actually be real and be valid, but maybe it's not that helpful. Like if you have the thought, wow, my coworker is really a nasty person and they're just out to get me. I don't even want to have to deal with that person. Well, that could be real. That coworker could be an awful person and very difficult, and they could be making your life at work really hard. But to dwell on that and to just focus on that, and the thought might be, well, that person just needs to change. That person needs to be fired. That person needs to get out of here. Well, that's placing all the responsibility for the solution on other people. It would be nice if those things happened. It would be nice if the person left the job. It would be nice if your boss talked to that person. But the reality of those things happening, that they might not. So what's the most helpful thing? And then you work with your therapist on possible solutions, things that you can do, that you have control over, that you can take responsibility for, that can help make the situation better. Another thing that's really the client's responsibility that can lead to, CBT not being that effective. And this one actually applies to all forms of therapy, not just CBT. And this is the idea of active versus passive. And when I say that, I mean the client taking an active versus a passive role. Sometimes people come to therapy and they look at the therapist as, the answer to everything. This therapist is just going to fix it for me. The therapist is just going to tell me what to do. But then even if a therapist does give suggestions for things that you can try that might be helpful, you still have to do those things. So what that means is that as a client, you have to take an active role in your own therapy. You have to take an active role in your own healing, in getting better. It's not necessarily going to work. It is helpful to be able to come to therapy and sit and talk about your feelings and what's going on with you. Yes, that's helpful. But if you're not doing anything to actively change, to make things better, to, as I said, control the things that you can control, then therapy is not going to work, right? If all you want to do is come to therapy and blow off steam and complain about what's happening to you and what all these other people are doing, that's not going to necessarily make anything better. You also have to commit to the process and to being an active partner in the process with the therapist. You have to commit to doing the work. That is how you get better. by being an active participant in your own healing and in working towards your own well-being. So the truth is, CBT is an effective form of therapy, but the reality is it's not a good fit for everyone. It really is about the match, that CBT has to be a good fit for that therapist who's using it, and that therapist has to do their best to make sure they're using it effectively. It has to be a good fit for the client's personality, for their particular issues, their particular struggles, the things that they are trying to work on and change. All of these things have to line up in order for CBT to be effective. So it's true, it's not the best form of therapy for everyone, but it can be a very helpful form of therapy. So before you make a decision about whether CBT is right for you, if you're starting therapy, or maybe you've tried CBT with another therapist and you didn't like it or it didn't work, keep some of these things from this video in mind and maybe give it a try and see if it could be a good fit for you. If you want to know more about CBT, be sure to visit my channel where I have lots of other videos on topics related to cognitive behavioral therapy and other mental health topics. If you liked this video, if you found it helpful, please be sure to leave a comment below. Or if you've had a negative experience with cognitive behavioral therapy, tell me about that in the comments. I'd like to know. If you have questions, I'd love to answer them. And be sure to subscribe so you don't miss any of my other tips about mental health and how to live your best life. Thanks so much for watching, and take good care of yourself, and I'll see you in the next video.